Good evening, Yuba and Sutter community. Today is Wednesday, May 27, 2020. The case count for the Yuba-Sutter region remains at 70, 42 for Sutter County and 28 for Yuba County. Our hospitalized case count currently is 1, and our death case count remains, fortunately, at 3. Today, because it's a weekly update now, I'm going to talk about several things. So first, I really want to share the exciting news that we have a second OptumServe testing site that's going live tomorrow, Thursday, May 28, at the Wheatland Community Center. So again, I want to encourage anyone who has even mild symptoms concerning or consistent with COVID-19, and they can be fever, chills, muscle ache, cough, sore throat, shortness of breath, and new loss of sense of taste and smell, to register online at the lhi.org website for OptumServe testing, and then you will most likely be given same-day appointment so that you can go and get tested, either at the new Wheatland Community Center OptumServe testing site or the current one, which is located at the Veterans Hall in Yuba City. I also want to talk about the importance of contact tracing. I know that it's really kind of a foreign concept. What's contact tracing? Why are these public health people calling me? In absence of a currently available vaccine and currently available widespread treatment besides remdesivir for hospitalized patients, contact tracing is actually our best tool, our best weapon to break the chain of transmission. So what does that mean? So when there's a positive case, I ask my public health colleagues to immediately contact that patient and say, hi, we've just been notified that you have tested positive for COVID-19. Can you tell us when you develop symptoms? And then based on that, we march out what's called the infectious period. So the period which we need to ask them for their close contacts, individuals that they have been interacting with during the time that they're infectious, so that we can identify them, contact them, and say, you've been exposed to a person who now has tested positive for COVID-19, and we guide them on what to do in terms of quarantining at home so that they don't inadvertently pass on the virus to another person, and continuing that snowball effect. Because if we don't break that chain of transmission, that's when we're going to have surges, that when we're going to have unwittingly multiple people passing it on to others, to their loved ones. And our very big concern is, what if we then also expose the most vulnerable? So individuals who are age 65 years and older, individuals who have chronic medical diseases, that if they do get COVID-19 will get the more severe form of COVID-19, leading to pneumonia, hospitalization, and possibly even death. That's the key reason why compliance and adherence to contact tracing, answering the calls when we do reach out to you if you happen to be tested positive, and or if you are a contact of a positive case, is really, really important and vital. As we move on to reopening more and more sector of our community, on Monday you saw the state pushing out guidance for faith-based organization to reopen with appropriate modification. Yesterday you saw the pushing out of guidance for hair salons and barbershops. More and more you're going to see individual guidances for specific sectors. It's very, very critical that when we see the gradual reopening of these sectors, that the entire community, every single resident, really adhere to the non-pharmacologic interventions of social distancing 6 foot or more away from non-household member, maintaining good hand hygiene, wearing facial covering when you're out in public, and staying home if you're ill with symptoms at all mild for COVID-19, because that's the only way that we continue to be safe and we can continue to return to a quote-unquote sense of normalcy quicker than we were expecting even, say, 2 months ago. Thank you. Have a good evening.